Hi, everybody. I hope you guys have all had a really nice week. I just wanted to take care of a few housekeeping things before we get into the lecture. First and foremost, you did a really nice job on your level 2 skills check on tub and toilet transfers. I was very impressed. I noticed that a lot of you have really built throughout the semester and taken it seriously. I enjoyed seeing you dressed professionally, and I really appreciate that you took the time to practice for this exam. Just a couple things that I noticed overall as a group that might be helpful in the future is don't be afraid to move the casters on the wheelchair. So those little wheels in the front of the wheelchair, if you turn them around, they won't stick out as far before you do the transfer, and then the patient won't trip on them and the front wheel walker won't be impeded. You all did a really nice job of staying in character throughout. I felt like you were very professional and you spoke really clearly, which was really great to see. If you're feeling like you don't have enough room to maneuver the wheelchair from behind, you can always come in front of the wheelchair and push it around if you need to do those last little minute changes. As you move forward in the courses and in the curriculum of this program, try to look at the levels of assistance. And as based on the different levels of assistance, you'll also need to adjust your body positioning to have better mechanics and so that you can transfer the patient safely to protect yourself and the patient. So as the reason I was giving both the patient and the therapist those little cards was so that you could see how much assist you should provide as the patient and then how you should move as a therapist based off of how much the patient was providing. You want to obviously bend and use more of your legs rather than your back when you're lifting, and you want to be closer to the patient the more assist the patient requires. Only a couple groups did this, but remember you really should be adjusting the height of the front wheel walker to accommodate the height of the patient. That is for patient safety, your safety, and it's just in the best interest of everyone. So take the time, adjust the height of the front wheel walker. It is only like less than a minute, but it makes a really big difference in patient safety. And then don't forget when you're putting in a slide board, you can help the patient lift their leg to get the slide board a little bit further underneath their thigh. This is something that I do all the time, especially if the patients are having a hard time rolling over to the side or leaning over to the side. I'll lift up their leg just to get that slide board in the place that I want it to look or want it to be. And then this is something you guys wouldn't know, but typically in the bathrooms or the showers, there's a string that the patients can pull, and that's their call light that they're utilizing. So I'll try to put that in one of the slides for you guys, just so you can see what it looks like. But yep, that's it. And then you guys have just a couple more assignments coming up. I did send out a couple announcements. The study guide with the questions for the final exam is posted. Please add your questions so that I can go through it and add some of the best questions to the final exam. And then please sign up on the sign up sheet for the availability of the room to film your final projects. And then once you sign up on the sign up sheet, remember to email Jack Hawley to make sure that the room is available. So I think that's it. If you have any questions, please don't hesitate to send me an email and I'll get back as soon as I can to you guys. So now we can get into the week 13 lecture. It's on infectious diseases, autoimmune disorders, oncology, and transplantation. I know it's a lot. We'll try to get through as much as we can, and then I will roll over into your week 15, whatever we aren't able to get to. So the immune system is the body's mechanism for fighting infectious microbes, which includes bacteria, viruses, parasites, and fungi. The body has protective barriers that provide the first line of defense in preventing infections by stopping the microbes from entering the body. Immunity. The immune system is the body's mechanism for fighting infectious microbes, including bacteria, viruses, parasites, and fungi. Non-living toxins such as foreign particles, drugs, and chemicals can trigger an immune response. The body has protective barriers such as skin, mucous membranes, cilia, and stomach acids that provide a line of defense in preventing infections by stopping the microbes from entering the body. Two types of immune system responses to infection are innate immunity and adaptive immunity. Innate immunity is when the immune system responds immediately to protect the body from all foreign substances. Examples of this can include fever, inflammation, which includes heat, redness, swelling, or pain. A fever, which is a systemic response to a harmful microorganism. Mild to moderate fevers are beneficial in fighting infections by increasing metabolism and boosting production of white blood cells and antibodies. Inflammation is a non-specific response to bodily injury, such as a physical trauma, extreme temperatures, chemicals, foreign bodies, ischemia, and infections. Like I said before, signs of infection can be heat, redness, swelling, or pain. Adaptive immunity is specific to particular foreign substances and enhances protective mechanisms of the innate immunity system. Adaptive immunity provides protection from later infections from the same microbes because it's able to form a memory. Infectious disease occurs when pathogens cause signs and symptoms of illness. Colonization refers to the state in which microbes are present in the skin or mucous membranes without signs and symptoms of active infection. Factors leading to a weakened immune system that can put a person at higher risk for acquiring infectious diseases includes compromised skin or mucous membranes, malnutrition, chronic illness, circulatory problems, advanced age, stress, surgery, and immune system deficits. Neutropenia is a condition caused by a low number of neutrophils or white blood cells in the blood. This causes the patient to be at increased risk for acquiring an infection. These patients are generally on neutropenic precautions, and typically these restrictions include no fresh flowers or uncooked foods to be allowed in the room due to the increased risk of exposure to infectious agents such as bacteria and fungi. Infectious diseases are among the leading cause of death in the United States and worldwide. Infections that are acquired during the course of treatment of other conditions within a healthcare setting are called healthcare-associated infections. This is important because patients with a hospital-acquired infection will have longer hospitalizations, will be sicker, and will have a greater risk of death compared to those who do not acquire an infection. Most hospital-acquired infections are pneumonia, surgical site infections, urinary tract infections, and primary bloodstream infections. Central venous catheters and urinary catheters increase the risk of acquiring a device-associated infection. 60% of hospital-acquired infections are caused by central line-associated bloodstream infections, ventilator-associated pneumonia, and catheter-associated UTIs. This is sometimes referred to as CAUTIs, C-A-U-T-I-S. The Centers for Medicare and Medicaid has developed initiatives to encourage hospitals to prevent hospital-acquired infections with payment implications if the infection could have been reasonably prevented. So if the patient gets a hospital-acquired infection and it could have been reasonably prevented based off of the investigation, the hospital will be fined. The Joint Commission has national patient safety goals to improve patient safety. Antimicrobial resistant organisms are also known as multi-drug resistant organisms, including MRSA and VRE. I'm not even going to try to say those names. I'm sorry, they're so hard for me. CRE is another type that has become resistant to all or nearly all of the available antibiotics, and it kills 50% of people who are infected with it. Much of the evidence shows that multi-drug resistant organisms are carried from one person to another via the hands of healthcare workers, which are easily contaminated through direct contact with an infected patient or with surfaces in close proximity to an infected patient. Artificial nails have been linked to significant outbreaks of hospital-acquired infections. Contaminated equipment such as stethoscopes, blood pressure cuffs, thermometers, gloves, and gowns increase the risk of infection transmission. So that means reusing the gown and gloves. That can increase the risk of that infection transmission. Wearing a clean uniform each day, along with improving hand hygiene practices, helps to reduce the number of pathogens on healthcare workers. Infectious diseases in healthcare settings. With all infectious diseases, there's a risk of developing sepsis, which is also known as systemic inflammatory response syndrome. Sepsis results from the spread of infection from its initial site to the bloodstream, which can lead to widespread infection and decreased blood flow to vital organs, resulting in tissue damage, organ failure, or death. Sepsis can be viewed as a three-stage process. The first one, just sepsis. The second one, severe sepsis. And the third, septic shock. When the disease progresses to septic shock, the patient is at increased risk for dying. Sepsis is most commonly caused by bacterial infections, but can also be caused by fungus, parasitic, or viral infections. Drug-resistant bacteria are often the cause of infections that trigger sepsis. If you'll remember, we discussed patients who are in sepsis are typically treated in the ICU if it's bad enough. At my hospital, we have a code sepsis, as this is a life-threatening condition. Occupational therapists are likely to encounter patients with hospital-acquired illness. Most of the activities that occupational therapists engage patients in have the potential to transfer infectious organisms. Occupational therapists should follow standard precautions when working with all patients. Standard precautions assume that all patients are potentially infectious, and therefore we should be performing hand hygiene and wear the appropriate PPE for all patients. This is why it was hammered at the beginning and it was included in all of your skill checks. Standard precautions include that hand hygiene and PPE, including gloves. Since COVID, standard precautions have also included masks and occasionally eyewear. Adaptive equipment must be cleaned after each use following the facility's infection control guidelines. If patients are on transmission-based precautions, the equipment should be dedicated for use with them and left in their room throughout their hospitalization and stay. Monitoring equipment, such as portable telemetry units, stethoscopes, must be cleaned after use with any patient. During toileting, it's often recommended that you double glove, and once one gets contaminated, take it off and you have the clean gloves underneath. And then obviously take both off, wash your hands before you start working with the patient. Occupational therapists may have to educate patients on activity modification due to the patient experiencing symptoms including fatigue, pain, loss of appetite, nausea, diarrhea, and fever that could interfere with their ability to participate in daily activities. Occupational therapists should be aware that infections can cause an increase in heart rate, respiratory rate, and blood pressure. That's why patients that are admitted in the hospital with infectious diseases, we're always monitoring their vitals and making sure that they are stable. A common infection that you've likely heard of before is C. diff. It's a bacteria that causes diarrhea and more serious intestinal conditions such as colitis. It's characterized by watery diarrhea with at least 3 bowel movements per day for more than 2 days, fever, loss of appetite, nausea, abdominal pain, or tenderness. These patients are on strict contact precautions. Therefore, therapists should wear a gown and gloves, and soap and water should be used when leaving the therapy, as well as therapists should wipe down all equipment with a bleach wipe. Sometimes you'll see a sign for enhanced contact precautions because this goes beyond just wearing the gown and gloves. You're having to do the washing your hands with soap and water after you leave, and you are wiping down with bleach wipes rather than cavi wipes. Another common infection that you'll see is CMV. Cytomegalovirus is a herpes virus found in body fluids including urine, saliva, breast milk, blood, tears, semen, and vaginal fluids. CMV is the most common virus transmitted to a pregnant woman's unborn child. Standard precautions are used with this patient. Good hand hygiene is important, and therapists should avoid contact with saliva of young children. At my hospital, people who are pregnant are not required to see CMV patients, and typically we will trade off patients if a patient is known to have CMV, just so that there isn't the risk of transmission to a pregnant individual. Another common infectious disease is CRE. It's a bacterial infection that's highly resistant to antibiotics, making it very difficult to treat and is sometimes deadly. At-risk populations include those in hospitals, nursing homes, or other healthcare facilities. It's transmitted through person-to-person contact, particularly wounds and stool, insertion of medical devices such as ventilators, IV catheters, and urinary catheters. Typically, with these patients, contact precautions are followed. Influenza. Influenza is another common infectious disease. It's contagious, and it's a respiratory disease caused by the influenza virus, which I'm sure you've heard of. At-risk populations include older adults, young children, people with health conditions including asthma, chronic lung disease, heart disease, diabetes, blood disorders, kidney disorders, or liver disorders. It's transmitted via person-to-person, via droplets, or direct/indirect contact with contaminated surfaces. The typical precautions for these patients include droplet and contact precautions. MRSA. MRSA is a type of bacteria that causes staph infections and is resistant to certain antibiotics such as methicillin, penicillin, and amoxicillin. MRSA is the most common MDRO, and at-risk populations are people who have undergone invasive medical procedures, people with a weakened immune system who have been treated in a hospital, healthcare facility, or have been treated for MRSA previously. For these patients, contact precautions should be followed as it is transmitted person to person. Pneumonia. The second most common hospital-associated infection is pneumonia. The primary risk factor is mechanical ventilation with endotracheal intubation. At-risk populations include those with depressed levels of consciousness, people with dysphagia, people with those endotracheal tubes, people with tracheostomies as well, and people who are post-surgery. So maybe they just were intubated for surgery, but they've been extubated. They are still at risk for pneumonia. Standard precautions for these patients should be followed. For patients, they are typically given an incentive spirometer for deep breathing, and it's important to elevate the head of bed from 30 to 45 degrees to prevent aspiration in patients with decreased consciousness, dysphagia, or who are intubated. Another common infectious disease is TB. TB is a lung disease caused by Mycobacterium tuberculosis. It can move to any part of the body, such as kidney, spine, or brain. Most cases are treated and curable. Symptoms of active TB include a bad cough, pain in the chest, coughing up blood, weakness, weight loss, no appetite, chills, fever, and sweating at night. The method of transmission is person to person and spread through the air. For these patients, airborne precautions are observed. Typically with these patients, we are also wearing those N95 masks because of the airborne precautions. VRE, vancomycin-resistant enterococci, is an infection of the urinary tract, blood, or wounds. At-risk populations are people who have been treated with antibiotics, people who are hospitalized, people with weakened or compromised immune systems, and people with medical devices that stay in them for a prolonged period of time. These might include urinary catheters, central IV catheters. VRE is transmitted person to person via human hands. Contact precautions should be administered when working with these patients. Although the immune system primarily works to prevent infectious diseases, a patient with an autoimmune disease has an immune system that is unable to distinguish between healthy body tissues and antigens. The immune system reacts to normal body tissues, resulting in a response that destroys them. The causes of autoimmune diseases is multifactorial and include genetic factors, environmental risk factors, infections, and reproductive hormones. Common autoimmune diseases can include rheumatoid arthritis, lupus, scleroderma, Guillain-Barré syndrome, multiple sclerosis, and myasthenia gravis. As occupational therapists, we may need to modify our activities and teach energy conservation and pacing techniques. Occupational therapists can use positioning and splinting to promote functional positions for these patients, decrease pain, and help to minimize deformities. In long-term management of these patients, common interventions can include education regarding outpatient occupational therapy, community resources, including disease-specific organizations and local classes, and support groups as needed. After this, we'll go into oncology.